Hello and welcome. If you or a loved one is navigating a breast cancer diagnosis, I want to start by saying, you are not alone. Today, I'll be breaking down the most effective strategies to help breast cancer survivors choose the right treatment. We'll explore different treatment options, the importance of personalized care, and how survivors can make informed decisions to maximize their chances of recovery and long-term health. Getting the right treatment first can significantly improve outcomes, so whether you're recently diagnosed or supporting someone through this journey, this information is here to empower you with knowledge and clarity. Let's dive right in. Section 1. Understanding your diagnosis, why it matters. Every breast cancer diagnosis is unique, and this is where it all starts. Treatments that work well for one person may not be the best option for another. Your cancer type, the stage, hormone receptor status, and whether the cancer has spread will play a major role in determining which treatment will be the most effective. There are different types of breast cancer: hormone receptor positive, HR+, cancers, which respond to estrogen or progesterone. HER2 positive cancers, which involve a gene mutation causing rapid cell growth. Triple negative breast cancer, which doesn't respond to hormonal therapy or HER2 drugs, making it more aggressive. Knowing exactly what you are dealing with can guide you toward the most appropriate treatment. Getting a second opinion and discussing your pathology report with specialists is also crucial at this stage. Section 2. Exploring treatment options. What are they? There are a variety of treatments available for breast cancer, each with different approaches. Here are the most common ones: surgery, lumpectomy, removal of the tumor and a small amount of surrounding tissue. Mastectomy, removal of the entire breast. Surgery is often the first step if the cancer is localized, but you'll need to decide between a lumpectomy and mastectomy based on your tumor size, location, and personal preference. Radiation therapy. Radiation targets cancer cells left behind after surgery. It's typically recommended after lumpectomy to reduce recurrence risks. Chemotherapy. Chemo targets cancer cells throughout the body and is often used when the cancer has spread or is at high risk of returning. Hormone therapy. For HR+ cancers, hormone therapy blocks estrogen from fueling cancer growth. Common drugs include tamoxifen and aromatase inhibitors. Targeted therapy. For HER2+ cancers, drugs like trastuzumab, Herceptin, and pertuzumab target the HER2 protein to slow cancer growth. Immunotherapy. In some cases, immunotherapy boosts your body's immune system to fight cancer. This is often used in aggressive forms, like triple-negative breast cancer. Section 3. Making the right decision. Tailoring treatments to your needs. Choosing the right treatment isn't just about what works medically, it's also about what works for you personally. Here are some key considerations to guide your decision. Personalized medicine. Genetic testing like the Oncotype DX test can predict how likely your cancer is to recur, helping to determine if chemotherapy is necessary. Balancing effectiveness with quality of life. Treatments like chemo and radiation can have side effects: fatigue, hair loss, and nausea. It's essential to weigh the benefits against the impact on your daily life and mental health. Stage of life and goals. Your age, fertility goals, and personal priorities matter. Some treatments may affect fertility, so consider options like egg freezing if you're of childbearing age. Second opinions matter. Consulting with multiple oncologists ensures that you're exploring all possible options. Every doctor may have slightly different strategies or access to clinical trials. Section 4. Side effects and how to manage them. The reality is that cancer treatments can come with side effects, but there are ways to manage them effectively. Here's how to tackle some of the most common challenges. Fatigue. Incorporate light exercise, like walking or yoga, to boost energy levels. Rest is essential, but staying active can also improve recovery. Nausea. Anti-nausea medications, herbal teas, and small, frequent meals can help control nausea during chemo. Hair loss. Consider cold cap therapy, which can reduce hair loss by cooling the scalp during chemotherapy. Emotional stress. Therapy, support groups, or journaling can help process the emotional rollercoaster. Breast cancer impacts both body and mind, and addressing your mental health is key. Section 5. Clinical trials. an option to explore clinical trials offer access to cutting-edge treatments that are not yet widely available. If your current treatment options are limited or your cancer is particularly aggressive, a clinical trial may provide new opportunities. Ask your oncologist if any relevant trials are open to you. Participating in one can also contribute to advancing research for future patients. Section 6. The role of emotional support. Survivors often say that emotional support is just as important as medical treatment. Whether it's your family, friends, or a support group, having people to talk to makes a world of difference. Consider these strategies for emotional well-being. Therapy and counseling. Speaking with a professional can help manage anxiety or depression. Support groups. Connecting with others who've had similar experiences can provide comfort and practical advice. Mindfulness practices. Techniques like meditation or deep breathing help stay grounded during tough times. Section 7. Lifestyle changes to support recovery and prevent recurrence. Making healthy lifestyle changes can support recovery and help prevent recurrence. Here are a few practical steps. Healthy eating. Focus on a plant-based diet rich in fruits, vegetables, whole grains, and lean proteins. Exercise. Aim for 150 minutes of moderate exercise per week, such as brisk walking or swimming. Limit alcohol. Studies show a link between alcohol consumption and increased breast cancer risk. Reducing intake can lower recurrence chances. Stress management. Chronic stress affects your immune system. Incorporate relaxation techniques to stay emotionally balanced. Section 8. Survivor stories. Finding hope in others' journeys. Hearing from other breast cancer survivors can inspire hope. Every story is different, but they all share a common theme: resilience. If you're feeling overwhelmed, know that there are countless women who have faced similar challenges and emerged stronger on the other side. Survivor stories remind us that cancer is not the end of the road, it's a chapter, not the whole book. Section 9. Final thoughts. Choosing the right path for you. There's no one-size-fits-all solution for breast cancer treatment. The key is making decisions that align with your medical needs, personal values, and quality of life goals. Take the time to explore your options, ask questions, and lean on your support system. Choosing the right treatment first can make all the difference. It's about finding a path that works for you and gives you the best chance of recovery and long-term wellness. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with someone who might benefit from it. Don't forget to subscribe for more content on breast cancer care, recovery, and survivor stories. Remember, you are stronger than you know, and you don't have to walk this path alone. This transcript provides practical and emotional support for breast cancer survivors, empowering them to choose the right treatment confidently. It combines detailed medical insights, personal empowerment strategies, and the importance of community and lifestyle changes.